Welcome to this video where we will continue our study of the blood vessels. Now we are shifting our focus on more of the physiological aspects of the vasculature. First, we will talk a little bit about the pulse and then dive in on a greater detail to the blood pressure, especially its regulation and issues with it. So let's get started. First, I want us to look at some definitions. And I think that we all are familiar with the concept of flow. So let's apply it to the blood flow. So this is a measure of an amount in a given time. So this gives us a good foundation to work from. But what I'm especially interested in is defining the concept of blood pressure. So if I asked you in an assignment to provide a definition, what would you say as for what blood pressure is? How to define it? Well, the key here is that blood pressure is a measure of the force that blood exerts against blood vessel walls from inside the blood vessels. And we measure the blood pressure as millimeters of mercury. So what is normal blood pressure? Well, the values range a little bit and get redefined every now and then. But somewhere around 120/80 milligrams of mercury. Some accept anywhere between 90 to 120 for the higher and 60 to 80 for the lower values. It depends a little bit. But what are these two different numbers? Why do we get two values for the blood pressure? Well, these are our systolic and diastolic values. And as you remember, systolic referred to the time during contraction of the heart. So here, the blood is squashed out of the heart with a great force. Remember the concept of high blood pressure and pulsatile fluctuation from our earlier video. So arteries are adapted to this high force, and it is what we measure here as the first number. And diastolic was the relaxation of the heart. And now ventricles are refilling. As a result, the pressure in the blood vessels, in arteries in this case in particular, is lesser. So that gives us a lower number. As an interesting side note, please spot that it is during diastole during which the coronary arteries supply the heart muscle itself with blood. So what affects blood pressure? Well, I have picked 4 that I want to discuss here. The amount of total volume of blood plays a role for sure. And the blood pressure is a sum of cardiac output multiplied by the resistance of the blood flow. So that gives us a nice formula that we may have seen before. And finally, we should also note the role of how well blood flows in the vessels and how elastic the vessels are. Another concept that I want to mention here is the so-called whitecoat syndrome. This refers to the fact that many of us show an elevated blood pressure when it is measured at the doctor's office. This can be attributed to the stress or anxiety or nerves due to seeing an MD or a nurse. So you really should monitor blood pressure at home in a comfortable and safe environment where you feel relaxed. That would likely give us a more accurate result. I also wanted to mention a concept of pulse. So this is sometimes referred as the heart rate. So this tells us the number of times that the heart beats in a minute. And we should consider just for a second that what causes this pulsatile beat that we can feel from the pulse points. And for that, I have a nice diagram for us to use. So here you will see at the top line the systolic pressure, and at the bottom line the diastolic pressure. So we will notice how there is a lot of fluctuation between these closer we are to the heart, and at aorta and arteries. So when we take the pulse, we are looking for this fluctuation to be able to tell whether whenever the heart has taken the beat. And an important message here is to note that the pulse is always taken from the arteries for this very reason. The pressure fluctuation disappears as the capillaries are reached and after them. So where could we measure the pulse from? Let's think of some sites. Taking a pulse is often one of the things that the nurses or healthcare assistants always do when you go to the doctor. This is considered as one of your vital signs, in addition to the blood pressure, respiratory rate, and body temperature. The locations where these are taken are usually places where the arteries run closest to the surface of the body, so they are easily accessible for us to record these from. So the most common place to take the pulse from is the wrist. This is our radial pulse. It is used perhaps most routinely, but by no means it's the only place where you can get a pulse from. Let's see some others. So from the neck, the carotid pulse, and from the wrist we can also do ulnar pulse. From the cubital fossa, the brachial pulse. From legs, popliteal pulse. From feet, posterior tibial and dorsal pedis pulse. From the groin, femoral pulse. From the temporal area of your head, the superior temporal pulse. Or you could also do external maxillary pulse. The big thing with these, I guess, is that we should always try to measure these from the same places if we are keeping a record of possible changes. And it is important for us to know what is the typical pulse for that particular patient. This is why we try to collect these every time you go to see a medical professional, so that we have a record of these, a baseline, if you wish. So the next thing that I want us to talk about is the ways how blood pressure can be regulated. And your textbook provides quite a lot of information on this. I want to avoid just repeating it, so I thought that let's approach this in a little different manner. Do you remember this diagram of the homeostatic loop mechanism? I mentioned at the time that it is an important one to be comfortable with because we will be using it in many instances. So this is one of those instances. But if you have forgotten this basic concept, I have again added a link to the end of this video where you can access an explanation of this. But this should be familiar, so let's carry on. So what I thought that we could do is to review the ways how blood pressure is regulated in a short term with this diagram. Let's give it a go. So our stimulus is a change in the blood pressure, and we had the set point for the normal blood pressure somewhere around 120/90. There. Now we have something known as a baroreceptor reflex. It is one of the body's homeostatic mechanisms to maintain the blood pressure at the constant levels, and it can act through the following three mechanisms as the receptor, or a sensor if you wish. So we have receptors or sensors at the carotid sinuses. These are slightly dilated areas where the common carotid artery divides in the neck. And then we have receptors at the aortic arch, and finally at the large arteries, especially at the neck and thorax. Note that we also have chemoreceptors that regulate the blood chemistry, such as the carbon dioxide concentration, oxygen saturation, and blood pH. These receptors are located at the aortic arch, large arteries of the neck. Well, these pass messages to the control center, which is typically the brain. In particular, the medulla oblongata in this case. This is where the blood pressure is controlled from. Remember that many of these vital functions were housed in the brain stem, one of the earliest structures to form, both evolutionary and in terms of a development of an individual, and one of the most protected areas too. From medulla, the messages are forwarded to other levels, for example, to hypothalamus and cortex. So how do we act on the blood pressure? Well, we can do medication, treat the cause, or utilize vasodilation or constriction. And I should also add, although not included in this figure, the role of hormones. For example, epi and norepinephrine, ADH, and angiotensin II. So this was a brief summary of our short-term regulation of the blood pressure. Let's have a look at the long-term regulation. This happens largely through the kidneys and by changing the blood volume. This in turn will have an effect to the blood pressure. So the two things that we might wish to do. If there is too high blood pressure due to too much volume, we might rectify this by eliminating some, by getting rid of it through peeing. Or if there is too low blood pressure resulting from low blood volume, we could start to conserve water in our body in order to maintain the volume and through that, the blood pressure. Your textbook offers a nice diagram, which you can see here. Study it on your own time. The left side shows a direct mechanism, while on the right side here, we have a little more complex indirect mechanism. This is also known as the renin-angiotensin-aldosterone mechanism. So I was thinking of what to say as a summary of all this, and I guess that this does it fairly well. Note that we want high enough, but not too high blood pressure. So this is where we will finish this lecture video, and in our next video we will continue our discussion of blood pressure and its effects.